Hello, everyone. I'm Laurie White, President of the Greater Providence Chamber of Commerce, and welcome to episode number 115 of Chamber TV. We are live on Facebook, we are live on Twitter, and we are live on YouTube with our very special guest today, Dr. McDonald from the Rhode Island Department of Health. A very timely episode, I might add, in that today is the one-year anniversary that COVID-19 showed up in Rhode Island. Dr. McDonald, welcome to Chamber TV. Thank you for taking some time out of your schedule today for us.
Yeah, Laurie, thank you for having me. I was just reflecting on that this morning, that about a year ago today was actually a Saturday because of leap year. And I spent my whole day at the Department of Health dealing with what we were doing with patient number one. So today is a very auspicious day, to be sure.
So patient number one, was that the young student at St. Raphael Academy?
No, that was from the same trip from Italy, though. The person who came back, wasn't the student, and that was the person who was ended up in the hospital. Unfortunately, they did well and survived it, and that's good news. It's been quite a year though since then.
Did it ever occur to you on that day a year ago that we would still be talking about this and this issue would be front and center?
It's interesting you say that. I think a year ago, what we were trying to do then was contain the pandemic, and we really thought we could do that. And that's what the nation thought at the time as well. In other words, the strategy then was, let's try to get as many cases as possible and stop the spread. Of course, a year ago, we didn't have treatment like monoclonal antibodies. We didn't have vaccine. And even a year ago, we weren't even telling people to wear masks, by the way. And I think that's just important to understand where we were. What we were saying a year ago was, boy, testing supplies are really constrained. We're doing our best to get you a test. And that was the big thing then, was case finding. And really, when you think about where we were last year, case finding is what we're really trying to do, find those cases. But I don't know that I could have imagined that we'd be here 9,000 hospitalizations later, regrettably losing 2,500 Rhode Islanders, but also a year later having vaccinated, at least for one dose, almost 200,000 Rhode Islanders, which that's a positive. That's something we can build on.
And certainly we were all back in our offices from a chamber perspective. Most of us, I don't think, decamped until March 19th. I think that was the last day that we were physically present with one another. And employers have had a major role to play over the course of the last 12 months in keeping their employees safe, protected, and also connected.
Yeah, it's interesting you say that. I'm coming to you live from my dining room, which we don't entertain guests anymore. So we've set the dining room up as kind of my place to talk to people. And it is interesting, but it's really funny. One of the things I've seen out of the pandemic is how much I can do from home with a laptop, a cell phone, and a willing spirit. I really can work effectively from home. So I haven't missed the commute to Providence, and it's been fun to kind of just work from home as it is a little bit. But I think that's one of the things we've seen that's a positive out of the pandemic, is how we've leveraged the technology where it's actually more efficient. Like, one of the things I'm noticing at meetings is I can be in a meeting, checking email, answering texts, sometimes even doing a phone call, sometimes even doing two meetings at once. And this wasn't possible when we were physically together. So it is interesting to me how the technology has really met the demands of the pandemic and allowed us in some ways to be even more efficient than we used to be, and definitely more productive.
Absolutely. So the news of the day, and we are taping this on Monday, March 1st, is that the trucks have begun to roll, and they are spreading out all across the country to deliver the newly approved Johnson & Johnson vaccination. So what can you tell us about when the vaccination is going to arrive in Rhode Island and what we need to know about that?
Yeah, so we placed our order for 9,100 doses of the J&J vaccine last night. So we expect it to be here either tomorrow or the next day. We're looking forward to it. I think the J&J vaccine is a big shot in the arm to our vaccine rollout. That pun was definitely intended, by the way, Laurie. And what I mean by that is, this is a good vaccine. I'm glad we have it. It's a single dose vaccine. It's safe. It's effective. And when you really think about the main outcome we're looking for, I know people hear a lot of percentage numbers about effective for this, that, and the other thing, but really what we're trying to do is prevent death. That's the main reason we're trying to vaccinate people, is prevent people from dying. And this vaccine, the clinical trials, was 100% effective at preventing people from passing away. That's something we can build on, and that's something useful there. Well, it was very effective too at keeping people out of the hospital. So part of why I say that is, there's such a temptation to compare the J&J vaccine to the Moderna and the Pfizer, but you really can't compare these vaccines because they were studied during different times. And it really is like comparing apples and oranges. So it's a great vaccine. I'm glad it's coming into our state. I look forward to its success here.
The next cohort of patients to be vaccinated, potentially under 65, is coming soon. So that is the next group. Is that correct?
Yeah, it's actually those who have underlying conditions and 60 to 64. So it's that 60 to 64 group and those with underlying conditions. And I think it's important that those who have underlying conditions, people with diabetes, kidney disease, certain lung diseases, and certain heart diseases, people who have compromised immune systems, anyone who's got cancer, that population, they shouldn't feel forgotten because they've never been forgotten by the Department of Health. But that's really the population we really want to get done next, or the highest risk group next. And part of why it's important is these high-risk individuals who have these underlying health conditions that put them at a greater risk of not doing well should they get the infection. We'd love to get the vaccine into their arms as soon as possible. And so we're looking forward to that group being done. Hopefully in the next week or two, we'll see them start. Right now we've had a nice momentum build with the 65 and older crowd. It was interesting. Both Thursday, Friday, and Saturday, each one of those 3 days, they had 10 to 11,000 people vaccinated each day across the state. That's really quite significant because back in January, we were vaccinating about 3,000 people a day. Now we're up to almost 9,000 people a day. So it's really taking off nicely. I see the momentum building very effectively.
So let's stick on this theme of the Johnson & Johnson vaccination arriving. You've ordered 9,100 doses, soon to arrive. So how does it work? Let's say that we're still working with the 65 and older cohort. When individuals show up to get their vaccination, depending on where they go, is that what is determinant of what particular vaccine brand they are given?
When you go to vaccinateRI.org to sign up for your vaccine, one of the things you're going to be able to see is at the sites where we give vaccine, you'll see which vaccines are being given. Now, right now, it's Moderna or Pfizer because that's all we have. And really, that is the dominant type we have right now. Keep in mind, 9,100 doses, it's a good number, but it's not a ton. But you'll see where it's offered. And, some people are obviously going to prefer the Johnson & Johnson vaccine because it is one dose, and others might have a different preference. And that's okay. Quite frankly, I think the best strategy for everybody is, the best dose for you is the next available dose. I wouldn't go vaccine shopping. I would just go where I get the next vaccine because I think all three of these are great vaccines. These are way better than I thought we were going to get. I really never thought a year ago we'd have three vaccines that'd be anywhere near this effective. It's really, really quite a surprise.
Mm-hmm. So that's good advice, not to go vaccine dose shopping, but some people might not be able to help themselves potentially. So is there anything in addition you can shed light on the J&J vaccination other than it's one shot? And are people going to be making a stampede to get the J&J shot because it is just one dose?
Yeah, so we can't have stampedes anywhere because we still have to have social distancing, my friends. And it's important to understand that, part of what's made the rollout of this vaccine different than any other vaccine we've ever done is the other structures and public measures we need to do. We need to have appointments so that people can be 6 feet apart and so people can kind of have the time they need to get the vaccine and have the time to be monitored. And this is one of those challenges that you have with the vaccine rollout is in every state is you have to set up appointments here to do this. Part of the reason why you have to do that is some states where they haven't done it that way, they've seen mass gatherings occur. And that's exactly what we're not trying to do, right? We don't want to have a mass gathering event and all of a sudden have a super spreader event based on people getting a vaccine. That kind of defeats the purpose of it. Having said that, I do think people are going to have preferences, but quite frankly, it's normal to have a preference. It really is. I would ask people to just keep an open mind about all the options you have there. And really what it's about right now, it's funny, I was talking to Jane Hayward a couple of weeks ago, and Jane runs the community health centers in Rhode Island. She was like, I'll take whatever I can get. And quite frankly, I think that's the best approach. We have 3 safe and effective vaccines. I would just take whichever one you can get to. This is one of those things where, back when I was in my Navy days, any port in a storm is where you want to go. We're still in the midst of a storm here. So any one of these 3 vaccines is great. So that's why I encourage people to just grab any one of them.
I had the honor of viewing a vaccine clinic, about 6 or 8 weeks ago in East Greenwich. The town there was standing up a clinic, and I had a chance to, take a look at the the throughput, the logistics associated with it, the remote temperature monitoring of the Moderna vaccine. What particular handling criteria does the J&J vaccine have that might be any different from the other two?
Yeah, the J&J vaccine, nowhere near the logistical challenges you see with the Moderna or in particular the Pfizer vaccine. It's a much easier vaccine to store. You can just go as a normal refrigerator, and it's comes in a 5-dose vial, and it's much easier to transport and store, and it's just a lot easier to deal with, which is going to be a benefit for a lot of people. It's going to make the rollout a lot more efficient because whenever there's less logistics, it's just easier to do these things.
When will you be in the market for additional vaccines? So 9,100 doses today. When does the next shipment come, and how long do you think 9,100 doses will take to be administered?
Well, I hope all 9,100 doses are given this week. It's certainly no reason why they can't be given all this week. And I don't know when we're getting our second batch. We're hearing the same information others are hearing from the national media. In other words, there's like 4 million doses ready to go, ultimately 20 million doses by the end of March. They've got to be divided up by the whole 300 and some million people who live in the United States. So we're going to get what we can get, but it's really one of those things where we get whatever we're allotted to. If you listen to the national media, though, it sounds like we're going to be getting 240 million doses in aggregate for the United States by the end of March. If you do the math, that's roughly 800,000 doses for Rhode Island. So we haven't seen those numbers for us yet, but if we're really going to get 800,000 doses of vaccine by the end of March, it's really going to change the dynamic. Like if you're wondering, are we going to be able to give that much vaccine? The answer is we're gearing up to make sure we can give that much vaccine. But this is what I see in the national media is that there's going to be 240 million doses. That would be a lot of vaccine for the country. And that would really give us an enormous amount of momentum. And I think we'd have a trajectory then to really get ahead of this pandemic in the United States. And Lord knows it's long overdue. The United States has had an awful hard time with this pandemic. When you look at how our country has done compared to all the other countries on the planet, we haven't done well. I mean, as the United States, we just have not done well. It's been a real challenging pandemic for us. Our mortality is higher, and we've had much harder time with it. So I think this vaccine rollout by the end of March could be a very exciting time for us.
So if I'm reading what you're saying correctly, you're saying that with 3 vaccines now on board, that the through rate in terms of getting more and more people vaccinated is going to go a lot faster.
Yeah, it will go. It'll definitely go a lot faster, and it will go faster if we keep it simple. It's one of those things, if we just focus on vaccinating people by age, in particular, it goes really rapidly. We do have to remember our high-risk individuals, though, with their underlying conditions, and we have a plan for them, so they'll get vaccinated very quickly. But I think that's where we just want to move the system through as quickly as possible at this point. Vaccinating a whole bunch of people, it's really about going faster and simpler. And when you think about our state, not everybody's eligible because right now the vaccines are only available for people 16 and older. But you're still talking about roughly 800,000 people who need to be vaccinated. So there's a whole lot more people we really need to get a shot in their arms. And that's something we're trying to do as soon as we can.
What are your thoughts about the various variants, if you will, and the idea that should that really take hold? Should it become so much more prevalent than it is now? Does that change the dynamic in terms of the pace?
Yeah, the variant is the wild card. And when I say the variant, it's like these are viruses that mutate, right? So there's 3 that have gotten a lot more attention. There's the one from the United Kingdom, which we've seen some of that in Rhode Island. There's one from Brazil and South Africa, which we haven't seen yet. There's another variant in California, which we just are still learning about. And the variant's a wild card. What I mean by that is, it's more contagious. Since it's more contagious yet causes the same level of disease, it presents a threat, which is all the more reason to get people to get vaccinated. But what's more important right now is this. I have to show you something, Lori, is one of the things we've been talking about is upgrading people's masks. So this is a KN95 mask, something I got online. You can also get a KF94 mask. I've seen the major online retailers have these. But if you wear these, they give you a nice seal. What's nice about a high quality mask is it really does offer effective source control. So I'm not a threat to others, but it gives a fair amount of protection to me as well. So I'm not so worried about, what others might do. So if I have to go out, go shopping or whatever, I've got that protection. But I think if there's one thing people can do right now to defeat the variant is keep your mask as high a quality as possible. Now, some people are doing double masking, which means you put a medical procedure mask on and then a cloth face mask. That's a good approach too. And some people are just wearing a nice snug fitting cloth mask. That's okay. But if you can upgrade your mask to a high quality mask, it does afford a fair amount of protection to you. We're actually handing out KN95 masks at our testing sites across the state. So if you go to portal.ri.gov for a test, you can actually ask for and receive one of these high quality KN95 masks. So if you need to go buy your own, you at least know what you're looking for. But this is one of the biggest things we can do right now to not let the variant overcome us in Rhode Island. I think that's really important. Is I am not conceding any ground to the variant. In other words, I would just soon keep this under control. And there's one undeniable rule of virology, and that is, yeah, a lot of viruses are going to mutate, but a virus that doesn't replicate cannot mutate. So if we can just simply stop the virus from infecting more people, finding a host, it won't replicate. If it won't replicate, it won't mutate. And that's how we protect Rhode Islanders and protect our households.
Mm-hmm. Absolutely. I do have a KN95 that I picked up when I visited the test site or the vaccination site in East Greenwich. And I did notice that the fit of it is a lot different. It's much more, covers the chin and it's less horizontal, if you will. But I know you want to underscore the point that even if you have been vaccinated, that you must and should continue to wear the mask.
Yeah, I know that almost seems unfair, doesn't it? You're like, I got my vaccines. Why am I still wearing a mask? But we just don't have the research yet to prove that even though you've been vaccinated, you're not transmitting virus. Until that research is done, which I think is going to take another month or two, we still have to wear masks. And part of why that's important is part of why that's not a given is keep in mind how this virus became a pandemic in the first place was there was so much spread of the virus from people who were without symptoms. So, people are walking around feeling fine, but yet they're spreading virus. And that's one of those things where we just can't fall to that problem again. That's why it's really important for people to say, you know what, we're not conceding any knowledge until we get the research to prove we know what we know. And that's why wearing a mask is still a really good idea.
Have we given any thought to, in a way that, we've really developed some traction around the notion of arming employers with vaccination stations?
Yeah, so right now, I don't know that you're going to see employers get vaccination stations. What I see more of is mass vaccination sites across the state. Right now, there's 2 mass vaccination sites. Of course, the one that we know about, but there's going to be 2 more. So we're going to have one in Woonsocket and one in Middletown. So, it's included on top of the one in Sockanosset and top of the one in the Dunkin' Donuts Center. We're going to have 2 more. And then there's another one that'll be announced soon. Part of why you're seeing mass vaccination sites across the state is so we can get as many people through there as possible. But some of it just has to do with the logistics. Mm-hmm. In order to get the Pfizer vaccine, you have to be able to handle 975 doses. In order to handle the Moderna vaccine, you got to handle a minimum of 100 doses. Not every employer is going to be shaped up to do that. And it would move slower going through employers. We would just need to move it through as fast as possible. One of the things you really see when you go to our mass vaccination sites, you just see how efficient a movement it is. I know at the Sockanosset side, I've been there several times. It just moves very efficiently. And I think that's one of the things that you hear from people, that it moves pretty quickly here. And so I think it'll be a while. And then keep in mind, we haven't even given vaccine yet to doctors' offices. Because quite frankly, for the same logistical challenges. And that's another place we'd like to see it roll out too. Of course, some of the community health centers have vaccine. A lot of them are doing a great job with it. The hospitals have vaccine. They're doing a great job with it as well. But it's really the vaccination sites that are in these state-run sites that are really giving the majority of vaccine right now, because they do move through these high volume numbers.
Yeah, that goes back to what you said a moment ago of trying to keep it simple so that you can be rapid. Will the J&J vaccine be available at the CVS, Rite Aid, other pharmacies, Walgreens?
So right now, what we plan for the J&J vaccines to be available at state sites, CVS and Walgreens. I would expect them to continue with the Pfizer and the Moderna vaccines. They're going to have both of those. The federal government will decide when J&J vaccine can be rolled out to pharmacies, but I imagine some pharmacies are going to be on board with that as well. It's, part of why the J&J vaccine is so attractive for pharmacies and doctors' offices, it's just stored like every other vaccine, and it's single dose. That one and done is really going to be appealed to a lot of people because you're going to feel like, this is a good vaccine. I'm getting my one, then I'm moving on with my life.
One and done. Doesn't that sound great?
It does sound great.
Music to everybody's ears. Well, speaking of one and done, what about the field hospitals? I know for now we have decommissioned the convention center and also the part of Saconaset that was actually used for inpatient treatment. What is the status of that? And are you anticipating that if needed, God hope we don't, that those facilities will be able to be quickly stood up again?
Yeah, so, one, thank you to Lifespan and Care New England for setting up the field hospitals. They did an amazing job with this. Between the two of them, they handled over 650 patients, which is great. We didn't have capacity in our hospitals for them. But right now, both those hospitals are what are called a warm status. In other words, there's no patients there, but if we need them again, we can turn them on again. I really hope we don't need them again. I really hope we just can do what we need to do. Because, one of the things we need to underscore is, as much as the pandemic's been a pain for all of us, and quite frankly, the pandemic's a pain every day for everybody, it is still a preventable disease. And we all know what to do. So I think it's incumbent upon ourselves to say, look, how can I be part of that solution and not lead the state into a problem? And part of why I say it that way is that as we get more success, there's sort of a natural tendency to say, look, I haven't been getting together with a bunch of people. I'm having a party. And, probably not the best idea right now. In other words, I shouldn't be driving around Rhode Island seeing a bunch of cars in front of anyone's house with a big party going on. You just kind of miss the story at that point, that we're not quite there yet. And I think it's one of those things where we have to decide what's important to us. And right now, what's important to me is protecting the health and safety of everybody. I want to keep everybody alive. We really need to do what we can, though, to help businesses open up. And that's really important. Like, the business community has taken a big hit right now. Not that anyone really needs to know this, but like in my family, we've had a small pharmacy in upstate New York for over 90 years. And, I grew up in that pharmacy. It was really a big part of my life growing up in that pharmacy. But it just changed hands last week. In other words, after 90 years, my brother my grandfather started it, my mother owned it, my brother owned it, but it had to change hands because, quite frankly, my brother said, you know what? It's just too hard to run a business during the pandemic. And that's a pharmacy where, they weren't even closed. But it's just so challenging for every business to run during the pandemic. And that's hard. It's hard to process a family business of 90 years having to change hands. It's still open, still has the same name, but that's a lot for people to process. But you've seen that happen. Way too many businesses have had to close. And I think, what one of our big focuses on how do we make sure that as we look at our pandemic response over the next few months is we allow businesses to grow, because we desperately need our economy to get not just back to normal, but thriving again. And, Laura, we're a tourist-based economy in some ways, manufacturing in other ways. We have a lot of great elements of our economy here. But the tourism industry was hit so hard last summer. We really had a non-season. We just can't afford to do that. We need to have a great Memorial Day and beyond this year. It's so important for our economy to let the tourists come and do that. And I think we're positioning ourselves where that's a possibility. And I really would like to see that happen. But that's incumbent upon all of us. One, get a vaccine when you can. Two, would you wear a mask in the meantime and listen to the public health measures? Because, come Memorial Day, I want to see a nice summer here. I really do.
Mm-hmm. And you think that's fairly good chance that we're going to see that?
I think it's up to us. I know that, people tend to think it's up to the Department of Health, but it's really not up to the Department of Health. It's up to us. I mean, I guess I'll say collectively, if we want to have a normal life again, we just need to look at this time as critical, because the variants are the threat and the wild card, but we have all the tools we need to succeed right now. In other words, we all know how to be 6 feet apart from everybody. We all know how to wear masks. And, quite frankly, if you can get a vaccine, you go get one. And there's other things you can do to make sure your ventilation is good. If your ventilation is good, you've really done a lot. Ventilation is one of the untold stories of the pandemic, but one of the things you really see, if you had a place where there was a super spreader event, the ventilation wasn't that good. And if the ventilation's optimal, you tend to not have those super spreader events. So, one of the things people are going to be able to do is open some windows sooner than later. Like today's a good day to open a window. But just make sure you have a number of good air exchanges per hour, like 4 to 6 air exchanges per hour. Get that relative humidity to 40 to 60%. Really make sure you have good ventilation in your workspaces and in your homes to the extent that you can. It really does help prevent the spread of the virus, and so you prevent those super spreader events.
Let me say that I'm sorry to hear about the situation with your family's business. There's nothing more painful than hearing stories like that, and certainly they're everywhere during the course of this. From a chamber perspective, we've definitely heard a lot of stories like that, and it doesn't get any easier to be able to, to react to that, because it is so difficult. Our audience, Dr. McDonald, as you know, employers, and in the couple of minutes we have left, we have 2 minutes left before you need to go on to your next assignment. Is there a specific message that you believe is really important to share with employers and those that are part of the workforce relative to returning to work or being able to return to work?
I think if there's one concept we've learned over the last years is how much we're all in this together. We desperately need each other. And I think that speaks to the social contract we have with each other. In other words, we're all dependent on each other. And part of the point I'm getting at right now is when you think about how we have this social contract with each other, it's in all of our best interest to look at what are the conditions that made Rhode Island so vulnerable to the pandemic. Some of these things aren't things we've talked a lot about, though, but it's like a lot of people in high density communities very much at risk. What about these social determinants of health that people keep talking about? In other words, why were the people who are Latinx and Black so adversely affected by the pandemic? When you look at the rates of cases, way off the charts about the Latinx population and the Black community as much as well. People of color were much more seriously affected by the pandemic than others were. We need to look at what is it that's driving that. It's the underlying health conditions, but to some degree, it's some of the social determinants of health. In other words, where people live, where they work, and where they go to school, that puts people at risk. And this is why I think as we look at where we are as a community, it's really in everyone's best interest to say, look, we really have to optimize everyone's chances at life. And what that means is healthy work environments, healthy places for people to go to school, healthy places for people to live, and quite frankly, affordable places for people to live. We do things like that. We help put people in a position where they're better able to withstand some of these predictable challenges that we're going to have now and in the future. Because, the pandemic was unpredictable, but it was also predictable. We also know that bad things happen. And so we've got to be prepared in the future to be able to deal with bad things.
It's interesting you point out the social contract with one another, and that kind of bumps up against this whole notion of individualism that we see so much in society today.
Well, that's us as Americans. It's funny. When I was in the Navy, I was in Japan for 2 years. And one of the things I saw about living in the Orient is there's sort of a utilitarianism to everything. Still a capitalist economy and everyone's trying to make their way in the world. But there was much more of a social contract and getting along with each other. As Americans, we tend to be more rugged individualists. And yet, being a rugged individualist doesn't always get the individual as far as we need to come. And, I think it's just something for us to reflect on is like, how do we learn from other countries during this pandemic? And I think one of the things we need to look at is why have other countries, in many cases, third world countries, done so much better at their pandemic control than the United States has? And I think if we answer those questions, we're in a much better place. In the United States, there was such a national mask ambivalence and confusion about people wearing masks. And that just perpetuated a lot of the pandemic for us. Rhode Island was actually quite good in this area, but we suffered some of the consequences from just people all over the United States confused about whether they should wear a mask or not, whereas we got that notion right away.
And I imagine in some countries where there's a heavy hand of the government in place and there's more acceptance of that kind of top-down mentality, that compliance would have been easier.
Yeah, I mean, compliance is easier when people have no freedom, but that's not the country I want to live in. I'll tell you that much. In America, we value our liberty, and rightfully so. And thank goodness we have our liberty. Being someone who was part of the Navy, it was like something I understood. It was so important to me. I was part of the Navy to do that. But it's like, I think it's one of those things where I think there's a way to balance liberty, but also equity. And that gets the notion of how do I think about what am I doing affecting the other people who live around me.
Excellent way to close out our discussion. Dr. James McDonald, thank you so much for being with us. When do you think the announcement about the 65 and under cohort, those with pre-existing conditions and others, when can we look forward to hearing that announcement?
I hope we're going to hear about it in the next week or two. My expectation is that as we see much more of the 65 and older population get vaccinated, we'll be able to open up for that. And some of that depends on how much vaccine we get. But obviously, I'd like to get there sooner than later.
Okay. Well, I hope come Memorial Day, as you point out, that first of all, you will be able to exit your dining room. And of course, it'll be the beginning, hopefully, of the summer season, and things will look an entirely bit different than they do right now. But on behalf of all of us at the Greater Providence Chamber, Dr. McDonald, thank you so much for your efforts. Our best as well to the director and your entire team for doing such an outstanding job under very, very, very difficult conditions and pressure. And thank you for being available to us at any time of the day and night, and also being available to all Rhode Islanders and continuing to do the excellent job that you are doing.
Well, thank you, Laurie. It's been fun to hang out with you this afternoon. I hope everybody has a good rest of their afternoon.
Well, I hope to see you again. Thank you.